We're
Okay. It's anyway. We can still do the intro without people in there. We are all welcome to the online masterclass session. Uh, the topic today is the global impact of COVID-19 on the elderly population. This masterclass session is hosted by the Masterclass Initiative, and we are privileged to have Dr. Latarsha Michael, subject matter experts, who will be facilitating this topic. Uh, so interested. We all know the global impact, and the COVID-19 is still on, and scientists all over the world are working assiduously to get a solution and to provide a vaccine possibly that will cure this ongoing pandemic. Uh, as put out here, COVID-19 has drastically affected individuals 65 years and older since it emerged in December 2019. We are very optimistic that Dr. Latarsha Michael will give an overview of this deadly virus and highlights effective ways to safeguard this vulnerable population against this pandemic. Uh, about the facilitator, Dr. Latarsha Michael has over 9 years of experience in public health and healthcare administration, over 13 years of experience in the mental health field, and over 9 years of experience in applied research and critical evaluation. I hereby welcome Dr. Latarsha Michael to
thank
take
you
on
so
the
much.
session. Welcome,
Thank you.
Dr. Yeah.
Thank you, Babatunda. Thank you. Thank you so much. Thank you for that introduction. Yes, I just want to take this opportunity to thank you again for this opportunity, as well as the Masterclass Initiative. Thank you so much. I also wanted to thank Minds Connect for assisting us in getting the word out about this presentation as well. Due to time's sake, I think I'm going to go ahead and dive on into the presentation. Again, the title is The Global Impact of COVID-19 on the Elderly Population. There it goes. Here is an outline of some of the topics that I'll touch on. Background about the disease, how it's transmitted, the vulnerable population that's most affected by this disease, as well as I'll dive into the regions and the territories, how they've been affected, number-wise, cases, things of that such. Here, coronavirus disease 2019. Now, this is a serious global health pandemic that has rapidly affected us across the world. The original name of this disease was novel coronavirus 2019. But now since then, the name has been changed. It's also known as SARS COVID-19 2, well, coronavirus 2, I'm sorry. And so it's an interchangeable name for that such, but most commonly we know it as COVID-19. This is a new coronavirus. It is something that is new to all of us, and that's one of the reasons why it's impacting us the way that it is or has been impacting us. It's similar to the 2003 SARS outbreak. And for those of you that may not be familiar with SARS, SARS is severe acute respiratory syndrome. So we actually had an outbreak back in 2003. So this disease is very much similar to that one. The only difference is it's less severe. No, well, it spreads more rapidly than the 2003 outbreak, but it's also less severe in illnesses. Some of the side effects of this new disease, it can lead to severe respiratory problems, kidney failure, as well as death. How is it spread? It can be spread from person to person, or now new emergent evidence has shown where it can be passed from person to animal. So just a little background on the coronavirus in regards to this family. This is a large family of viruses. So we have some viruses that affect humans, and then we also have some viruses that affect animals. Some of the common ones that affect animals are called the canine coronavirus or the feline coronavirus. Ways that it's also spread is through respiratory droplets that are also known as aerosol transmissions. So that's through coughs or sneezes. And also new emerging evidence has shown where the World Health Organization has acknowledged that it could also be airborne. Now, this is something that scientists and researchers have been saying for some time now. However, the World Health Organization, they did not want to acknowledge that as being so. But most recently, as of earlier this week, I believe they officially went out and acknowledged that this disease can also be traveled through air. Other ways that it is said to be spread, although researchers and studies show that it could be it's rare that it can be contracted this way. If it's in a virus infected surface or object, if you actually touch that object and touch either your mouth, your nose, or your eyes, you get contracted that way. So that's also a way it's spread. It's not as common as the airborne and the aerosol transmission, but however, that is still a possibility. Vulnerable populations, the populations that are most affected by this COVID-19 virus, or that will, pretty much still most affected by it, are individuals that are 65 years and older, individuals living in nursing homes or long-term care facilities, or individuals of any age that have an underlying medical condition. Here, this is just a map that actually gives you a view of all of the areas, locations, and regions that have been affected by COVID-19 thus far. This here is a map depicting the territories that currently have confirmed COVID-19 cases. So, although it's so many areas that have already been affected by COVID-19, there are some that have had some cases of recovery and that are free of current cases. So this is what that map looks like as of July 9th. Confirmed cases. These are confirmed cases on a global aspect. We have over 12 million confirmed global cases, over 500,000 confirmed global deaths. And we also have where it's about 216 countries, areas, and territories that have been affected. However, last reported, we had 12 countries that have reported no cases and have not been affected by COVID-19 as of yet. Hopefully that will continue to be the case. These are COVID-19 cases in regards to the World Health Organization region. Just broke it down some for you guys. We have Africa, the Americas, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. So as you can see here, Africa currently has the lowest cases in the world. Africa and Western Pacific have the lowest deaths in the world. The Americas have the highest cases as well as deaths, and Europe has the second highest in cases and deaths. So let's touch on Africa. By the month of May, only 1.5 million citizens have been tested. However, Africa has 1.3 million citizens. So, but only a fraction of those citizens had been tested at the time in May. By July 8th, they had over 11,000 deaths that had occurred due to this virus. 80% of the infections occurred in people under age 60. One of the reasons for that, Africa has the youngest continent demographically. So they do not have that many elderly. It's only about 5% elderly population in Africa. COVID cases in the United States. So as you can see here, the United States has over 3 million cases. It also has over 300,000 belonging to the elderly population. Then when we look at deaths, we have over 130,000 deaths, and about 65,000 of those deaths occurred in the elderly. Here, this is looking at long-term facilities in the United States, And in the long-term facilities, we had about 1/3 of COVID cases by May 2020. So 1/3 of those cases occurred in long-term care facilities. That was by May 2020. A little time after, by July, we were looking at 42% of COVID cases occurring in these same settings. And then you had about 10% of all US cases occurring in long-term care facilities. We also had where many were affected, up to 296,000 people in those same facilities, as well as 14,000 fatalities resulting from COVID-19. In South America, Brazil has the second highest worldwide cases. So we have the United States is number 1, Brazil is number 2 in cases and deaths. Peru and Chile, they were hit the hardest in regards to per capita, which is like per unit or per person. So they were impacted the most in South America. Argentina reported the first Latin country death that was related to COVID-19. Also, half of France's deaths, which totaled, the half of France's deaths totaled the amount in nursing homes. So half of France's deaths occurred in long-term facilities. Eastern Mediterranean. So here in this region, Iran, it has the largest total of COVID-19 cases. The average aged individual that died was 67. The first COVID case there in the MENA region, which is the Middle East and North African region, the first case there was reported in January 2020. You have Tehran, it's categorized as one of the largest epicenters of the COVID-19 outbreak. So this area is seen as like the center for the COVID-19 outbreaks in this particular region. Afghanistan, I thought this was, it just blew me away. They saw a 684% increase in infections. Okay, let's touch on Europe. So in regards to Europe, the Netherlands, 80% of their casualties occurred in patients 75 years and older. That's a very high number for this population. They had about 22% occurred in ages 85 to 89. Belgium actually had 42% of its cases to occur in care homes. So in actuality, Europe had over 95% of their deaths occurring in older individuals 60 years and older. Over 95%, very high. Southeast Asia. In Southeast Asia, in Lion City, it's a area in the Singapore area. They had the most infected Southeast Asian, they had the most infections in Southeast Asian nations. Indonesia, it had the second largest group of fatalities, and Malaysia had over 50% of its 99 COVID deaths to occur in individuals ages 61 to 80. Western Pacific. So they had a little good news to actually share in this area. New Zealand, the Prime Minister, she announced on June 8th that they were at that point free of all active cases. Now they had originally reported 1,500 cases. No deaths that I could find in regards to the research. However, by June 8th, they were free of any active cases. So they actually had a bit of good news to share there. Japan, they had the highest number of severely ill individuals ages 60 to 69. Their highest death cases in age 80 and over. Now, in regards to Japan as seen as having the oldest average population. So like how Africa did not have many elderly, that's the opposite of Japan. They actually have the oldest population in their area. So why are these regions or our regions affected differently? I thought that was something that was very interesting to look into. So research shows that viruses, it mutates pretty much the same. You know, all viruses mutate the same way. And also as humans, we all have the same general immune responses, right? So the virus spreads the same, we all react to it the same. So why is there a difference? Scientists feel that regional differences and the differences in testing, the control of countries, those are things that need to be looked into. So not so much as focus on our immune responses, but actually looking into how regions are being ran, how tests are being conducted, and things of that such. And then another big crucial part to look into is the rate of chronic illnesses by countries. Because one of the reasons why we have vulnerable populations, or what makes a population vulnerable, is if they have an underlying condition. So if you have an underlying condition, then that'll make you more prone to respond negatively or severely to this disease. So scientists actually want us to look into that, pretty much how the regions are being ran and things that are affecting the region. They want us to actually look into that before wanting to revise policies and other factors. So that's, I thought that was very interesting. Another reason why it had been reportedly to spread differently is the delay in the response to the epidemic. We basically have situations where each country, each area, each location, region, they're all responding differently or responded differently to this epidemic. So Many felt that if a speedier response in some area had taken place, that maybe the cases and the death rates wouldn't be as high as they are. Being more so proactive rather than reactive could have very much benefited a lot of regions in this case. You have where the United States and Western Europe, the reluctance to actually see this disease or this virus as a threat, them not seeing it as a threat early on, is actually attributing to the high numbers that we're currently experiencing in these areas. Whereas areas like Asia, Taiwan, South Korea, they actually rendered speedier responses. And that being said, that's why a lot of individuals feel, or the scientists and researchers feel, that their cases aren't as drastic as the United States or Europe, because they responded quickly. One thing that helped some of the individuals, especially in Asia, was their time with their experience with the first SARS outbreak. The first SARS outbreak, they actually responded more quickly this time around because of their past experience. So they're actually being commended for responding so rapidly. Common ways that COVID-19 is spread in long-term facilities: confined environments, living and cohabitating in close proximities. As many of you all know, in long-term care facilities, it's very rare that you see patients having a room of their own. Many have a roommate. It may even be as many as 3 in the room. And even though they may not be, or they may be at least 6 feet away from each other in regards to social distancing, just still being in that confined environment, we now see that this disease can be airborne. So even if they're social distancing, being that they're in there still breathing the same air, they still have a chance of contracting this virus. Reports were in regards to workers in the nursing homes not having the proper personal protective equipment. I've read some researches where many workers, healthcare providers, expressed that they were given rain ponchos and goggles to protect themselves away from the virus when working with or serving their patients. This is not proper equipment. So of course, a lot of them contracted the virus because they were not protected properly. Also here, in regards to race and ethnicity, research shows that nursing home or long-term facilities that were predominantly Black or Latino, regardless of their federal government rate, they were still seen as being more likely to be affected by COVID-19 than predominantly white nursing homes. Basically meaning that regardless of how good of a rating the actual facility was, being that if it was predominantly a minority race in that facility, they were still more likely to actually contract this virus. Meaning it has nothing to do with how it's rated. It has more to do with your immune responses and also your genetic buildup. You know, those are some serious factors. So prevention, I'm sure by now all of us should know the common ways to prevent against this virus. We're constantly told and reminded to wear face coverings, social distance, frequently wash our hands, and stay home when sick. Precautions that can be taken. Take everyday precautions. Always be alert and vigilant. Stock up on supplies. Clean and disinfect often. avoid non-essential travel, and new research shows where people are being infected by their communities. So not only are they encouraging us to social distance and wear our protective gear when out, but they're also saying limit your interactions with individuals that are not in your household. Healthy strategies for the vulnerable population. Sorry, talking too fast. I'm trying to hurry up, Babatunda. But healthy coping skills for this population, for our elderly. Assist the elderly, assist them in developing healthy coping skills to actually avoid depression or abandonment issues. Because with this self-isolation and having to social distance, people can fall into a deep depression. People can feel abandoned, and especially this population. And that's not something that we want them to feel right now. A plan of action. Who will assist this population with essential things that they need to do? Help safeguard them, this population from this virus. So we may have to be the ones to actually go to the store for our elderly loved ones, just trying to keep them out of that environment, just to better their chances of not contracting this disease. Mental health care. Mental health care is something that I seriously stress. It's a type of prevention. All populations actually need it, but mental health is one of the best things that can be done for this population. One thing that I love to stress, this is a phrase: prevention, intervention, mitigation is key. Core practices. One second, guys. Throat is getting parched. Core practices for long-term care facilities and homes. Establishing an infection prevention control program, if it is not currently in place. That's one of the first things that all long-term care facilities and homes should do. Put coronavirus precautions in place. That's strongly needed. Being sure to educate their residents, their workers, and visitors on these precautions. Implement source control measures. That's something that is a dire need. Appropriate supplies. Make sure the staff has the appropriate protective gear to protect against this environment. Okay, I'm getting my alert up here, Babatunda. Let me see. So here, we just have some innovative global partnerships that have been established that I just thought there would be some helpful information. We also have the CDC, Centers for Disease Control and Prevention, things that they're doing globally. There's also more information on the CDC on a more local and a local region aspect. And sorry guys, this is your takeaway. Basically just telling us how serious the global threat is. This coronavirus is a serious global threat. How the elderly population, sorry guys, elderly population is disproportionately affected, as well as the implementation of healthy strategies and interventions. Here is my contact information for those of you that may want to continue this dialogue or have future collaboration. And those are references. There we go. Thank you, guys. Sorry, Babatunda. So did you want me to try to use the last few moments to actually answer questions or things of that such? We are going to try to get that in as well, correct, Babatunda? I need to unmute you. Okay. So what I'll do, I'll just assume that he wants me to open this up to any questions or concerns or additions that any of you may like to add at this time. Let me see. Let's go to the chat box. It's okay. Unmute me. I'm trying. I don't know why it's acting so silly. Okay, we got a hand raised. Okay. I'm not understanding why it's not allowing me to unmute you guys. It's asking me to ask you to be unmuted. Let's see. All right, can you, oh, nope, it didn't do it. Let me try this, guys. Okay. You guys are allowed to unmute yourselves. Hassan, can you unmute yourself now? Because now it's saying that you can. Let's see, you have your hand raised.
Madam, can I ask you a question?
Sure, go ahead.
First of all, my name is Zainab Hassan Said. I am from Somalia. I wanted to ask you in two questions.
Okay.
The first is COVID-19 has had a huge impact on the richest countries. Do you think they can recover as economically?
Okay, I want to make sure I'm understanding your question correctly. You're asking if it can be, if it's affecting us economically. Is that the question?
Yeah.
It truly is. Now, I know in the Americas, I'm actually in North America, the United States, and it has affected us tremendously economically because we've actually had to shut down a lot of businesses, a lot of establishments, a lot of places have gone out of business. So it definitely has affected us drastically economically. And I feel that that's occurring all over the world at this time. So yes, very much so. Good question. Any others? I hate that we're against this timeline, this time frame here. There were some other things that I wanted to touch on, but for the sake of time, I actually did not. So
yeah, my question, Dr. Mitchell. Recently, what do you have to say about the recent discovery of the
uh-oh, I think it's kind of making you go out a little, Babatunda. The recent, what's that again? Can you hear me? Yeah, our connection is getting a little weary towards the end. But also, if you want to text it. Oh, I can hear you now. There you go.
Okay, I said as regards the recent discovery by the Madagascar, as you know, they said they discover if how will I say a herbal. Do you hear about that?
Okay, say that one more time, Babatunda. I couldn't hear you. It's doing what? The virus is doing what now?
I said as regards the recent discovery by Madagascar on the herbal medicine that really can cure the virus, but it's still under test. Do you know about that?
Now is that so? And I want to make sure I'm understanding you correctly. You're saying that basically they had found some type of vaccine that is
yes.
It exactly. Now, I know that they've been diligently working on a vaccine. Now, I have not heard of one as of yet that has been stated to conclusively be the vaccine for this virus. So I have heard of several different vaccines out there, but I have yet to hear from a reputable source of one that has been successful or will be successful in actually curing this disease. So I have not heard of that as of yet. Not one that has been concluded to do such a thing. But good question. I think I got another hand raised here. Saito, if I'm pronouncing that correctly. Go ahead with your question. You should be unmuted.
Good evening, doctor. Good evening, doctor.
Can you hear
Yes.
me? I hear you talking. It's just a little low.
I'm Gomez Cyril and I'm from Cameroon. So my question was also on that herbal discovery. So I'm from Cameroon, and then there is this doctor who has also discovered that herbal medicine that cures people